to manage pregnancy. Stahl Say speaks about war, TBI, drug use, and more. Color helps us recognize mood disorders in disguise. But there's one thing that no one knows. What's Dr. Stahl say?
Remember, I told you that's both genetic and epigenetic. And the genetic one may have some normal and abnormal sequences, and the epigenetic may be normal sequences, but abnormal expression when it should be on when off or off when on.
What's Dr. Stahl say?
You make the C, which is normal, it makes more methyls. Why do you care? Because putting methyls on the promoters means you make fewer copies of COMT. You ain't got as much COMT, the dopamine you got isn't chewed up as much.
What's Dr. Stahl say? The secret of his talk, pharmacology. Somewhere deep in the brain, I know it's binding. What is the sign? Will we ever know? And what is the affinity? What did he say?
S-N-R-I. This is the kind of crap you'll get in the literature. Oh my God, what's that? The peens, the don'ts, 2 pips and a rep. These answers might not even be right by the time we come to next year's Congress. I told you it was correct as of noon today. Your brain's on fire. It's pretty darn important whether you're on or off. Ah, Bernie. MTHFR, one of my favorite abbreviations. So we need to talk a little about genetics, which of course is about your grandmother. Let me ask you, how many of you actually seen a patient who responded much better to one antipsychotic than to another? There's actually no evidence for that. You're all wrong.
What's Dr. Stahl say?
I've got patients that don't get sedated on drugs they should be sedating, and I get patients that get sedated on drugs that aren't supposed to be sedating. So this doesn't mean anything. I mean, we put it out there for a rookie. Any rookies here? No, we don't let you come in the door.
What's Dr. Stahl say?
Doesn't say you can't do it. Doesn't say if you give it, it won't work. Doesn't say if you give it, it will cause a side effect. Doesn't say you can't do it. Doesn't say if you give it, it won't work. Doesn't say if you give it, it will cause a side effect.
What's Dr. Stahl say?
So that's what's going to be, ladies and gentlemen. Suck it and see, as they say in Britain.